seeing it right away? Can you see it?
Yes po.
Yes, sir.
Yes po, Doc.
Anyway, as I have reiterated, no, please, no, share the material, no, whatever learnings that you will be having today, to your other classmates, no, in particular Block A and B, because I made use of an old slide yesterday, which were stored in my old laptop because this laptop, no, was destroyed. Okay, so it was just repaired. So anyway, um, our last session last time dealt along with the nematodes, in particular, the two classes of nematodes, correct? So as I've said, we have two classes, the Aphasmidea and the Phasmidea. And the two classes of nematode is basically because of the presence of the caudal chemoreceptors. So if they have the caudal chemoreceptors at the posterior portion of the adult parasites, then they are labeled as phasmids, Phasmidea or Cercentea. But in the absence of the caudal chemoreceptors, no, which will guide them, supposed to be where they are, no, in the body, and even when they are outside the body, they are accessed with a cephalic or cervical chemoreceptor, no, and obviously these cephalic or cervical chemoreceptors are at the anterior portion, no, of the parasite, no, nearly 1/4 from the anterior of the parasite, and they will be labeled therefore as aphasmids, aphasmidea, or adenophorea. I have a run through of some of the organisms which are aphasmids, like Trichinella spiralis, Capillaria philippinensis, which are aphasmids of your small intestines. Deoctophyma renale is an aphasmid of your kidney. Trichuris trichura is an aphasmid of your large intestines. No? These are the organisms that were already asked in the board exams. That's why I have placed them already here in your handouts. No? For phasmids, no, we have hookworms, ascaris, and strongyloides. They are phasmids of your small intestines. Enterobius vermicularis are phasmids of your large intestines. The filaria worms, that includes your Wuchereria, Brugia, Onchocerca, Loa Loa, and Manzanella species, are phasmids of your tissues. Okay, so this morning we will dwell with Ascaris lumbricoides. No? The common name of Ascaris lumbricoides is giant intestinal roundworm. Now, why is it named as giant intestinal roundworm? Because it is the biggest among the nematodes harboring in the intestines. But the largest or the longest of the nematodes is Dracunculus medinensis. So Dracunculus medinensis is 1 meter long. Ascaris lumbricoides is only 1 foot long. However, it is, no, the biggest in the intestines. Okay? Because Dracunculus medinensis resides in the varicose veins. Now, second that you should know is Ascaris lumbricoides is the most common of the nematodes isolated in the laboratory. Second would be Trichuris trichura. But remember, this is not the most common of the nematode, because the most common of the nematode in the world is your Enterobius vermicularis. Okay, so I would like to repeat that. No, Ascaris lumbricoides is the most common nematode isolated in the clinical specimens in the laboratory, but the most common in the world would be Enterobius vermicularis. Hence, the common name of Enterobius vermicularis is society worm or familial worm. Now, looking back at Ascaris lumbricoides, no, we are going to describe about the life cycle of the parasite. And of course, in the life cycle of the parasite, I told you that there are three specific stages, correct? The ova, the larva, and the adult. So let's discuss first about the ova of the parasite. And we have three types, right? So we have the immature, the mature, and of course, no, the embryonated ova, of which I reminded you, no, last time that the moment the infective stage is the ova, then the specific infective stage is the embryonated ova. Now that happens, that holds true with Ascaris lumbricoides. And therefore, since we have three types of an ova, I would dwell first with the character of the mature ova, so that we will be able to differentiate it from the characteristic of an immature ova and an embryonated ova. For me, it's important that we discuss with the mature ova because this is a viable ova. When I say viable ova, it can proceed to the next developmental stages. Unlike for the immature ova, which is a dead end stage. No? When you talk about immature or unfertile ova, that is the end of it. It does not develop to the next stage. No, it does not become a larva, farthering into an adult. No, but the mature ova becomes embryonated, and then eventually it becomes a larva, and apparently it becomes an adult. Okay, so what do you need to know about the ova of Ascaris rhombicoides? It has three shell layers. No? Okay. Can you guys hear me loud and clear? I have three shell layers. Okay. Now, the first layer of the parasite, no, the innermost layer of the parasite, is known as your chitinous layer. No? A chitin is a protein cytoskeleton which is highly impermeable. Chitin hard, impermeable. No, okay. Now, this chitinous layer, or what we refer to as the true shell. In some books, they would say it is a true shell. No? Why is it known as the true shell of the parasite? Because it safeguards vitelline layer. It safeguards the lecithin granules. The important part of the ova, the most important part of the ova would be the lecithin granules. So that develops into the parasite, the lecithin granules. So the innermost layer, okay, would be the chitinous layer, which safeguards the lecithin granules. Okay, the second layer is known as your vitelline layer. No, the second layer is known as your vitelline layer. The vitelline layer is dubbed as your fertilization layer. Now you realize that the difference between immature and mature Ascaris rhombicoides ova would be the presence of the vitelline layer. The ova has the vitelline layer, which is the fertilization layer. Then we say it is in fact a fertilized ova. The moment it does not have that, then it is a unfertilized or an immature ova. Okay, and then the last one would be your outer layer. No? The outer layer is known as your albuminoid layer. Okay. The other name for your albuminoid layer is chorionic layer. Okay. Now, what is the purpose of having the outer layer? It works for two functions. The first one is a protection function. So it is valued because it has a role for protection of the ova. This is the outer layer. No, it provides types the cortications. Pag sinasabi natin cortications, ito yung pagkulot-kulot niya. Naintindihan? So when I will be letting you see an ova, this for example is the ascaris rhombicoides ova. This is a fertile ova. And then you see the last layer, hindi ba parang kulot-kulot? Naintindihan? That is basically because of the existence of your albuminoid layer. Is it clear? And not only for the cortications, but importantly, it gives the tan color. It is the tan color of the ova of the parasite. Meaning to say, even if no, the smear, the stool smear, was not prepared no, in an iodine stain, no, even if it just would be a saline smear, so to speak, you would see the ova to be tan in color. Tan is near ecru or yellowish, light yellow or light brown in color. That is the color of the Ascaris rhombicoides. So in the exams, they would talk about tanning axon. Pag sinabing tanning axon, then it is the tan color of the parasite. So that is no the layers of your mature ova. Now you realize, no, I wanted to reiterate that the difference between the mature and immature would cut across the presence of your vitelline layer. Naintindihan? This one, this particular layer. Of course, no, when you talk about the morphology no, of the mature, kapag sinabi natin morphology, what is the shape of the mature? It is spherical no, in shape. No, it's spherical in shape. Okay, so I'll give you a example. This one is the ova of your mature Ascaris rhombicoides. No, the one down is also your mature Ascaris rhombicoides ova. Okay. Now, the one in the middle, this is your immature Ascaris rhombicoides ova. That's immature. Now, let's try to understand this time the difference between the immature from the mature. No, obviously, no, what is the difference? Vitelline layer. Walang vitelline layer yang immature ova. Second, no, the shape is not spherical. It is actually broad and ovoidal. Correct? It is broad and ovoidal. And the third thing that you have to know is that the granules are not known as the lecithin granules because that is a non-viable ova. Okay? So what are the granules that you see inside? No? We just have to simply call them as refractile dense coarse granules. And that's it. Naintindihan? Refractile dense coarse granules. Okay? Unlike for the mature ova, of which we give emphasis to the lecithin granules. Okay, and then this one is a stool smear, and can you see the ova inside? No, can you see the larva inside the ova? Yes, right? So that is your embryonated ova. This is the infective stage of Ascaris rhombicoides. Can you see the developing larva inside the ova? It just is waiting for the ova to hatch, right? Okay, so that the larva will be liberated. And when it's liberated, obviously, it starts from being rhabditiform, getting filariform larva. Okay? So I hope I am clear, right? Okay, so there is such thing as what we refer to as decorticated ova. No? Okay, this one is commonly asked in the exam. No? This one, I will have to write something. No? Itong tinatanong, decorticated. When you say decorticated ova, it has no third layer. Kalbong parasite. Naintindihan? Kalbong ova. No? It does not have the third layer. What is a third layer called? Albuminoid layer. When it does not have the albuminoid layer, then it is known to be decorticated. Okay. Now, Mr. Jethro Banasan, no, I'm going to ask you a question, anak. I hope you can answer. How many layers or what are the layers of a decorticated immature ova? Decorticated immature ova. Can you tell me about the layers, no, of the decorticated immature ova, or how many layers will it have?
Sir, we have two layers po, sir.
So, if it is decorticated, and what
We,
happens?
we only have the innermost and the middle layer, sir po.
We don't have, no, it's an immature ova.
Ah,
Immature. How many layers do you have for immature?
layer.
You have immature ova, unfertile ova. We have only two layers,
Yes,
right? The
yes, sir.
layer and the albuminoid layer because it's immature. The moment it is a decorticated immature ova, how many layers will be left?
One layer, sir.
Only one, correct? What is that layer? The innermost layer.
Most layers.
Naintindihan? Naintindihan. Ganyan sa board exams, anak. No? Pag hindi nyo naiintindihan sa sa board ngayon, sa board exams lalo na. Ang simple lang tanong, sabi niya, what is the layer when you talk about decorticated immature, no? Ascaris rhombicoides ova. So ang sagot, syempre wala na yung outer layer, wala naman siyang second layer which is the vitelline layer, and then you have only the true shell or your chitinous layer. Is it clear? Naintindihan? Okay. So going over, no, I told you that the parasite needs to proceed with embryonation. And last meeting, I told you about the requirements of Ascaris rhombicoides for embryonation. 2 to 4 weeks in the soil. And what is the character of the soil? Again, it should be loam, moist, warm, shady soil, right? 2 to 4 weeks for embryonation. Now, if you try to take a look, this is the embryonated ova of which has already hatched. Naintindihan? It is trying to liberate already your larva. Okay, so this is the first stage larva we know as your rhabditiform larva. Is it clear? So this is okay a hatching ova of Ascaris rhombicoides. And soon, no, as it hatches, then the one no in your left is your rhabditiform larva, shorter, okay, stouter, open mouth, vegetative, correct? And then after several moltings, in particular for Ascaris rhomboides, it requires 3 moltings to become, no, okay, the filariform larva. The one in your right is known as your filariform larva. That is the invasive stage. Is it clear? Invasive basically because Ascaris rhomboides is a visceral larva migrant. It's a VLM. And of which case, since it is a VLM, no, please remember that filariform larva will aid in distributing the parasite to different parts of the body. Okay? So this one are the adult parasites, right? So from the rabitiform turning filariform, it requires 1 molting to become the adult parasites. And I also have underscored last time that's only in the adult stage when you are able to determine for the sex of the parasite, right? So what are the cardinal rules last time? Males are smaller than females, right? Males would have a carved tail, whereas females would have a pointed tail, things like that. Okay, so let's try to take a look. Can you see? I'm pointing at one parasite? Do you see where my arrow is? Okay, so that is a male parasite because the posterior portion is curved. Is it clear? No? And it's actually a smaller, no, parasite as compared, obviously, to that of your male parasites. Okay, this one is a male parasite. It's too long. No? If you try to look into the posterior portion, it has a pointed tail. Things like that. Okay, is it clear? This one. Okay, so that is the character of the adult parasite. Another that you have to know about the adult parasite is that they are cream to white in color. They are extending until 1 feet long. There are numerous, obviously, in your intestines. It depends on the intensity of your infection. And going to the buccal capsule of the parasite, I would like to repeat that the parasite is trilobed, no? Trilobate lips, trilobed buccal capsule. Tatlo ang kanyang lips, no? Parang gusing parasite, just so to exaggerate. Naintindihan? Tatlo ang kanyang lips. Naintindihan? Trilobate lips. Naintindihan? Okay. Now, in terms of pathogenesis, no, I told you that the parasite is a visceral larva migrant. So, ladies and gentlemen, the infective stage of the parasite is the embryonated ova. The moment it is ingested by a viable host in the intestines, it becomes a rhabditiform, turning a filariform larva. And the filariform larva can migrate to other parts of the body. No? Now, to highlight its being visceral larva migrant, the first stop or the first organ that is infected by the parasite is known as your liver. Naintindihan? Now, what happens in your liver? No, since the liver, no, is actually, no, being infected, we have what we refer to as ascaris, hepatic ascariasis. The disease is known as hepatic ascariasis. No? There is obstruction of your Ascaris rhomboides filariform larva in your biliary duct. Again, of which case, the person becomes John Dick. Naintindihan? So, John Dick siya kasi parang sabihin natin hepatic ascariasis. So, magkakaroon ng jaundice. Okay, yung tao. And jaundice means yellowish. So, that would be the first step. First step, yeah. From the liver, it proceeds to the lungs. So what happens in the lungs? There are 3 diseases which I would want to discuss. The first one is disease. The second one is your Loeffler syndrome. My dear students, Wakana's disease and Loeffler syndrome are actually similar in terms of clinical manifestation. And what is the clinical manifestation for both diseases? We have what we refer to as um, hypersensitivity reactions. Okay. So we blatantly will call it as allergic reactions, of which case there would be eosinophilia. There would be a very distinct eosinophilia in the peripheral blood smear. So Wakana's disease and Loeffler syndrome talks about hypersensitivity reaction or allergic reactions. Why is there going to be hypersensitivity or allergic reactions? Because of the movement of the parasite to that part of the body. Naintindihan? So there would be adverse reactions. It will be manifested through hypersensitivity. Naintindihan ba? Okay, dahil sa movement niya, magkakaroon ng parang allergic reaction yung pasyente. Okay. The third disease here is known as your Ascaris pneumonitis. In terms of Ascaris pneumonitis, please remember that it is a typical pneumonia. I think you know exactly about how the typical symptoms, no? Typical symptoms of pneumonia, but no hemoptysis. Okay. So what is hemoptysis? Hemoptysis describes about coughing out of blood. So there is pneumonia. Pneumonia would mean that there would be a sputum that will be expectorated by the patient, but the sputum does not have blood, no hemoptysis. Of course, there would be fever, no, and all others of the symptoms expressed when you have pneumonia. Again, I would like to reiterate, no hemoptysis. In one part of the board exam, they have asked, why is there no blood, correct, being shelled out, no, by the person, no? Basically because, no, the filariform larva size. Okay, so please remember that there is no distinct no hemoptysis or coughing out of blood on the very issue that the filariform larva, which is the culprit for larva migration, has a size which is 0.01 millimeter, which is similar to the size of your alveoli. No, what is the alveoli? The alveoli is the air sac. That is a basic unit structure of your lungs. So what happens? It can freely just move in and out of your alveoli. Labas-pasok lang siya, naintindihan, sa alveoli na hindi nagkakaroon ng pagdurugo. Naintindihan? Yan yung rason kung bakit walang hemoptysis. Naintindihan ba? Okay na tayo? Okay, so after the lungs, it moves into your pharynx, it ascends, naintindihan, until obviously your mouth. So you have a choice whether to actually spit it out or smear your sputum or your saliva to bring the parasite, no, back into your small intestines. Naintindihan? So choice mo yan. Minsan, kaya napapansin nyo, sinasabi ng mga kapatid nyo, makati yung mga yung bunganga nila, kuya, lalamunan ko, and then something is going out, no? Pag gugulat ka, may bulating lumalabas. Naintindihan? Marami yan sa mga poor communities. Nagtatanggal tayo ng mga bulate. In fact, kapag nagde-deworm kami sa communities, magugulat na bigla silang susuka, ang dami nilang isisukang mga bulate. Kasi nai-irritate, naintindihan, yung mga parasites the moment you're going to take albendazole, mebendazole, or ivermectin. Naintindihan? Yun yung mga drugs na binibigay natin, anti-deworming drugs. Albendazole, mebendazole, and ivermectin. Yung ating Antiox ay isang mebendazole. Naintindihan? Mebendazole yung Antiox. So, dalawang tableta ng Antiox for an adult, okay, will be required for us to purgate ourselves. Okay? So, that is how it is. Now, my dear students, we have here a case, naintindihan, of a serious Ascaris rhumbicoides. So, hindi po yan longganisa Ascaris flavor. Naintindihan? Makikita nyo, parang large intestines yan na punong-puno ng adult parasites. Bakit nagkaganyan? Naintindihan? Dugyutin yung tao na magagawa natin. Naintindihan? So, in that particular case, no, dahil sira na yung kanyang large intestines, we performed bariatric surgery. Pag sinating bariatric, B-A-R-I-A-T-I-C, bariatric surgery, we remove some organs at we have to connect the organs which are remaining. So the case of this patient, ang remaining organs na lang is your esophagus and that of your intestines. No, whatever remained, yun na lang yung pinagdugtong. That's bariatric surgery. Okay. So I was like talking about Wakana's disease a while back, as well as your Loeffler syndrome and your Ascaris pneumonitis. If you perform a lung biopsy, no, coming from a patient whose lungs have been invaded by the larva, okay, of Ascaris rhamnosus, in particular filariform larva, and stain it using HNE. HNE talks about hematoxylin and eosin stain, then that is how it looks like. So this is a cross section of the lungs that has the Ascaris rhamnosus. So what is being pointed by an arrow is the filariform larva in the lungs. Alright, so I hope I'm clear with that. Okay, so let's move into obviously the discussion on Ascaris. And as I've said a while back, the adult worms habituate in your small intestines, right? Okay, it is in fact a phasmid of your small intestines. Adults multiply, and a large number of resulting undeveloped worms, no, are passed in feces. Now, there was one question in the board exam several years ago that allowed our students, no, to interpret the results. Like, all of the Ascaris rhamnosus ova seen in stool were immature. So what is the implication? Yun ang tinanong sa board exam. Anong ibig sabihin kapag lahat ng nakita mong ova ay immature? Ang sagot dyan ay there are no male adults inside the intestines that fertilized the female. Naintindihan? So whether you like it or not, the females would always have to lay ova, but the problem is the moment they are not being fertilized by a male adult, then the ova becomes unfertile. Naintindihan? So what is the issue if there are all of the ova are immature ova? There's no male adult. Is it clear? Okay. So the soil provides the necessary conditions for ova to embryonate. So as I've said, it's 2 to 4 weeks for embryonation. The infective stage are viable for years in the soil. Just take note, it has 3 shell covers. Naintindihan? So these are the virulence factor. Mahirap din mapatay yung ova sa soil kasi meron siyang tatlong layers protecting it, no? And eggs are not easily destroyed by chemicals. Again, it has attributions to the shell layers. No? The infective stage is embryonated. So I surmise there's no problem with Ascaris rhamnosus, and therefore we proceed now with your next parasite, which is the hookworm. Okay, my dear students, when you talk about the hookworm, you talk about 4 different parasites. No? The species are Necatur americanus, which is the New World hookworm, no? Which exhibits S-shaped adults. Ancylostoma duodenale is known as your Old World hookworm, of which the adults, no, happen to have a C shape. No? And then we have Ancylostoma brasiliensis and Ancylostoma caninum. So we have 4. Okay, species of hookworms. Now, when you talk about hookworms, that is in fact a common name. The hookworm is a common name. And why are they dubbed? Why are they described to be hookworm? Because they would have 90 degrees ventral bending, no? 90 degrees bending on the anterior of the parasite. Para siyang hook. Nakita niyo yung kamay ni Captain Hook, 'di ba ganyan? 90 degrees bending. Ganyan kasi yung itsura ng anterior portion ng parasite. Naka-hook siya, hook shape. Okay? Parang kurtina na may hook. Hook ng kurtina, right? Naintindihan? Okay, so the hookworm there is in fact a common name. The species are those that I actually have had told you a while back. Now, my dear students, when you talk about the hookworm ova, it looks like morula balls. No? I will let you see a morula balls ova. This is a typical type of a morula balls ova. So makita nyo, yung ova ng Ascaris kanina, it appears fried egg appearance, right? Mukha siyang fried egg, right? Yung ova ng Ascaris. Ito naman, ganyan pala ang morula balls. Now, my dear students, I would like you to focus on the inside structure of the ova. The inside structure is known as your germ cells. We call it as germ cells. G-E-R-M, no? Germ cells. Yan yung mga nandyan sa loob. Germ cells ang tawag dyan. Okay? Now, the morula balls ova of all of the species appear to be the same. So, pag nakita mo, morula balls ova, hookworm to. Naintindihan? Anong klaseng hookworm yan? Hindi po yan masasagot ang ova nyo. Naintindihan? Lahat sila magkakapareho ng itsura ng ova, no? Okay, pati ng tinatawag na larva. Sabi ko last meeting, I will not dwell on the larva anymore kasi in the succeeding meetings kasi pareho lang naman yung sasabihin ko, yung rhabditiform sa filariform across all of the parasites will be similar. Naintindihan? So they will just differ in terms of their adults, right? Sabi ko yan, no? They differ no, in terms of their being adults. Malalaman mo, Necator ito, Ancylostoma species ito, kapag adult parasite na sila, but never for an ova of the parasite. Is it clear? Now, one thing that I also need to remind you is that another parasite, the next parasite we will be discussing, dubbed as Strongyloides stercoralis, has also morula balls ova. Ang gusto kong sabihin dyan ay hookworm and Strongyloides vermicularis no, will have similar ova no, appearance, that is morula balls. The only difference would be your germ cells. Why? Hookworms would have 4 to 8 germ cells. Strongyloides stercoralis will only have 2 to 4 germ cells. Okay, 4 to 8 for hookworms, 2 to 4 germ cells for your Strongyloides stercoralis. But remember, no, as parasitologists, there are ways by which we are going to species identify. Naintindihan? Ang sinasabi ko ay kahit pare-pareho silang morula balls ang itsura, we need to species identify the parasite. No? And what are ways to do that? No? I disclosed one time in my lecture about the Harada-Mori filter paper culture tests, right? There's another test. No? We have the Baerman funnel tests. No? Okay, these are culture tests. Now, what are the uses of these culture tests? Inuulit ko ha, Baerman funnel tests as well as your Harada-Mori filter paper culture tests. What are the uses of these tests? Number one, it would have to confirm if the ova is in fact a hookworm ova or Strongyloides ova. No? Kasi pareho nga silang morula ball. So, hookworm ba yan or strongy? Gawin mo yung Harada-Mori filter paper culture test or Baerman funnel tests. Now, the second is, if it was confirmed as a hookworm, it aids in identifying the species of the hookworm. Naintindihan? So, hookworm. Hindi to strongy, no? Hookworm, no? Anong species ng hookworm? Masasagot yan ng Harada-Mori filter paper culture tests. Naintindihan ba? Okay? So, yeah, we are on the part where I was describing about the ova of the parasite, which is morula balls ova, no, that contains germ cells inside. Okay. Now, my dear students, let's look at this particular ova. The one in your left is in fact, no, is considered as your Strongyloides, and the one in your right, no, this one, is in fact your hookworm. Now, Dr. Kapili, how did you even manage doing that? No, the answer is because I performed no Harada-Mori filter paper culture tests. Now, several of my medicine students, no, my medical students were like telling, now, what if the medtech has reported a hookworm ova? Will it still matter that we will have to determine whether it is hookworm or Strongyloides? The answer is no. If not that you are performing research, the moment they will have to tell you it is a hookworm ova, then you treat the patient immediately. Because whether it is hookworm or Strongyloides, they deserve to be treated and they will have the same treatment requirement. And that would be your mebendazole and albendazole. Is it clear? Naintindihan? Sinasabi only for research pala na kailangan mong alamin kung anong species ng hookworm at kung hookworm ba yan or Strongyloides. My answer is yes. Is it clear? Naintindihan? Okay, so for example, sa laboratory later on, no, kapag nakakita kayo ng hookworm, then relay it to the doctor anymore. No, you need not to advance, no, confirming whether it is hookworm and not Strongyloides, or it should be, or should it be hookworm. You need not to actually identify it whether Necator or you would have your Ancylostoma species. I hope I had my piece fairly clear with you. Okay, my dear students, no, this is the embryonated ova of your hookworm. But one thing which I would like to clarify is that the infective stage of hookworm is not the embryonated ova. The infective stage is your filariform larva. And therefore, the mode of transmission of your hookworms would be skin penetration. Sana naisip nga, no? Ascaris lumbricoides, ingestion, embryonated ova. No? Hookworm, filariform larva. Mode of transmission, skin penetration. Is it clear? Now, because no, you have the um, filariform larva as the infective stage, remember, you cannot have them on the larva stage not unless you have the ova embryonating in the soil, correct? So still it requires the soil for embryonation, similar as that of the embryonation requirements of your Ascaris lumbricoides, 2 to 4 weeks in soil embryonation. And obviously, the ova hatches in soil to become your rhabditiform, and then eventually your filariform larva. And then the filariform larva normally would have to penetrate the skin of man, in particular in the feet of man, and then causes now a disease. Naintindihan? Are you with me, guys? Naintindihan ba? Okay. Now, let's look at how important this table is. No, this table describes about the 4 species, no, of your Necator americanus, differentiated, no, on size of the adults, the buccal cavity of the adults, and of course the bursa. No, the bursa is the fan-like structure of the gubernaculum. Naintindihan? Okay, naintindihan ba? Okay. Now, let's look first into the size of the parasite. No, obviously we remain with the dictum: males are smaller than females. But what is the smallest and which one is the biggest from among hookworms? You would glare into the table that Necator americanus is the smallest, and the biggest would be Ancylostoma caninum. Okay? Naintindihan. The smallest is Americanus, the biggest is Ancylostoma. Now, what about the buccal capsule? The buccal capsule talks about the mouth of the parasite. If you could remember, no, my lecture last time, I told you that the digestive system is a complete system, and that the buccal capsule or the mouth of the parasite is accessorized. May mga accessories yan. No? Necator americanus has no teeth, but it has semilunar cutting plates. In some books, they would say dorsal tooth. No, so if you don't happen to appreciate what a semilunar cutting plate is, no, just rekindle about the elevator. Yung elevator nagbubukas, nagsasara. Naintindihan? Parang ganyan. Okay, ganun ang itsura ng semilunar cutting plates ng mouth ng Necator americanus. Okay? Now, what about Ancylostoma? Ancylostoma species have teeth. Duodenale have 2 pairs of teeth equal in size. Braziliense have 2 pairs of teeth unequal in size. Caninum has 3 pairs of teeth, no, unequal in size. So the mnemonics there is A, B, C, D. A, Americanus, B, Braziliensis, C, Caninum, D, Duodenale. A, B, C, D, 0, 2, 3, 2. 0, Americanus, no teeth, 0. Naintindihan? Braziliense, 2 teeth, unequal. Caninum, 3 teeth. Duodenale, 2 teeth, equal. A, B, C, D, 0, 2, 3, 2, unequal, equal. Is it clear? Naintindihan? So that is the mnemonics for you to be able to easily memorize the character of the buccal capsule. Now let's proceed to the bursa. No, the bursa is the fan-like structure which I was like reiterating a while back. Okay, so what do you expect inside the bursa? Okay, naintindihan? Anong nakikita mo sa loob ng bursa? Anyone? Bakit nawala? Nawala ako? Hi?
Hello, sir.
Excuse me? Hello?
Hello, sir.
Nawala yung shinare?
Hindi po.
Meron naman po, sir.
Sa akin lang na nawawala. No, anyway, sige. Balikan ko kasi sa akin siya nawala. No. Anyway, when you talk about the bursa, my dear students, bursa, dorsal rays. No? Now, Ancylostoma, no, duodenale are tripartite. Ibig sabihin, 3 lobes. Bawat bursa. Left and right bursa contains 3 lobes. No? Kaya tinawag yung tripartite. Maintindihan? Whereas, Necator americanus would have 2 lobes per bursa. Kaya ang tawag sa kanya, bipartite. Maintindihan? Okay na tayo? Okay na? Okay. So, for Necator americanus, you'd have bipartite dorsal rays. It would have a deep cleft. Deep cleft. Ibig sabihin, the union between the bursa masyadong malalim. Deep cleft. Okay? Hindi siya katulad ng duodenale, shallow cleft. Ganyan, no? Shallow cleft. Yung isa, deep cleft. Naintindihan? And then, obviously, the most important structure there would be your spicule, the copulatory organ, yung titi niya. No? And Necator americanus would have fused or barbed. Take note of the words that I used. Fused or barbed. No? Ibig sabihin, sila ay na buhol, ganyan na barb. Anong tawag dyan? Na punggos, no? Na pato. I don't know what else, no? They are clamped. Naintindihan? Barb. Okay? Ancylostoma duodenale, on the other hand, as well as all the other Ancylostoma species, would have a shallow cleft and the spicules are unbarbed, unfused. In other words, kung buhok yan, sa duodenale, siya ay buhaghag. Kapag Amerikano, siya ay na-braid. Naintindihan pa? Naintindihan nyo na? Kaya naman, no? Okay. So in terms of Ancylostoma adult, no, Ancylostoma duodenale is referred to as the reference parasite, no? Why reference parasite? For you to be able to diagnose Ancylostoma brasiliense and caninum, you'd always have to refer it to the character of your duodenale. Okay? So what particular, no? Your bursa. You see the bursa of your brasiliensis. It is shorter and stubbier. Mas maliit yung bursa niya pero mas mas matataba, no? Sa caninum naman, naintindihan, maliliit naintindihan ang kanyang bursa pero mahaba yung kanyang bursa. Is it clear? Naintindihan? So yung normal would be duodenale. Brasiliense would have a shorter and stubbier bursa. Caninum would be having a longer and slender bursa. But remember, they are Ancylostoma species, and of which case they are exhibiting tripartite dorsal rays. They have shallow cleft, and of course, they would have unfused or unbarbed spicules. Questions so far? No questions? Hi? Okay. So let's proceed. No? This is the beauty form of your hookworm. So since that is rhabditiform, that is not yet the infective stage. I told you last time it has an open mouth and so it is a feeding stage, right? Okay, so it is actually stouter, right? And then, of course, this is already your infective stage. No? That is what penetrates your skin to establish an infection. Okay? So that is your filariform larva. Is it clear? Naintindihan? So my dear students, these are microscopic, no? In the aid of the microscope. Kasi I told you last time that it's only the adults which are macroscopic. Is it clear? Okay. So more pictures of the rhabditiform, they look like this. So ganyan, ganyan pala ang rhabditiform, no? Now, in the board exams, the moment you will be asked about the motility of your larva, the answer is purposeless motion. No? I repeat, no, purposeless motion. Because the adults would have a motility which is figure of 8. Naintindihan? I repeat, figure of 8 motion for the adults, purposeless motility for our larva forms. Okay. Questions? No questions? Mr. Agati, do you have a question? None?
None, Doc. None, Doc.
Mr. Magat, do you have a question? Magat is absent. Okay. Amiena Sara Katubag, do you have a question?
No.
Okay, none. Okay, so let's proceed therefore with the discussions. No? Now, this is a product, no, of the Harada-Mori filter paper culture tests. Now, for some of you who could barely remember about the procedure for Harada-Mori filter paper culture tests, no, we just have to probably enumerate it again. No? So, you only perform Harada-Mori filter paper culture test, mga anak, if the ova of the parasite is seen in stool, if the hookworm ova is seen in stool. So one requirement, no, before you do Harada-Mori filter paper culture test is that the direct fecal smear showed positive ova for hookworm. Naintindihan? Kung negative yan, huwag ka nang gumawa. Naintindihan? Kasi sabi natin, hookworm yon pero hindi mo alam kung strongy yan. No? At, well, kung hookworm man yan, anong species yan? Kaya kailangan mong gumawa ng Harada-Mori filter paper culture test when you're doing research. Okay? So, how do you do that? No? Okay. So, as I've said last time, you need a filter paper, a strip of filter paper, and of course, that filter paper needs to be hanged in a applicator stick. Okay? Now, on the top area of the filter paper, which is hanged in the applicator stick, you place a pea size of a stool sample taken from a DFS analyzed positive of hookworm stool. Naintindihan? Lagay mo yan dyan. And then you're going to place it in a beaker. Place water, no, in the beaker, of which the water should only be until the tip of the filter paper. Doon sa pinakababa niya lang. So maliit lang yung tubig, no? Naintindihan? Just enough to touch the tip of the filter paper. Okay? You're going to place it in a closed setup. Maintain it at 28 degrees Celsius. Lumabas yan sa board exams, mga anak. 28 degrees Celsius for temperature of Harada-Mori filter paper culture tests. What is expected is that the filter paper will absorb, correct, the water, which allows the hatching of the ova, and then of course the rhabditiform larva will proceed, okay, because that's motile stage yung larva, will proceed to the water. So every day you're going to take water samples, no, and view that under the microscope, and then report, no, that the time that you have seen purposeless motile motion of your larva. Naintindihan? So, for example, if it's going to be on the 7th until the 9th day that you're going to first see motile larva, then you report it as your rhabditiform hookworm, rhabditiform stage of a hookworm. Now, you have to incubate it further, 10 to 13 days. Naintindihan? So I repeat, pag sa unang 7 to until the 9th day, may nakita kang purposeless motion na larva, you report it as hookworm larva. And what are we suggesting you to do? You have to incubate it longer, no, until the 10th to the 13th day, so that, no, what you will recover would be your filariform of your hookworm. Naintindihan? Filariform of your hookworm. Now, what you're going to do there is, the filariform hookworms, the moment you were able to recover them already, you place 1 drop of your formalin. That would kill the parasite, no, in a manner that the mouth is open. Look at what I have in the illustration, in the photo that I've taken, correct? So this is a product of Harada-Mori. When I have placed already the formalin, then it happened to be that the mouth was open, correct? And that the mouth is what you're going to view under the microscope. Why? Because the hookworms can be species differentiated through their buccal capsule. If they have no teeth, then that would be Necator americanus. If they would have 3 pairs of teeth, that would be Caninum. 2 pairs of teeth equal in size, Duodenale. 2 pairs of teeth unequal in size, then that would be your Braziliense. Is it clear? Okay na tayo. Now, for example, if it's going to be on the 10th to 13th day of which you will first recover larva, then report it as rhabditiform of Strongyloides stercoralis. Okay, naintindihan na? Okay, so if it's gonna be, no, only until 10th to 13th day that you will recover motile larva, you report it as your Strongyloides stercoralis. And do you need to incubate further? No more, no, because there are no other species of Strongyloides. No? We just have incubated further, no, kapag hookworm. Naintindihan? Kasi nga, kailangan natin is-species identified. Okay, do you have questions? Who did not get what I was like explaining? Hello? Mr. Larry James, did you understand what my explanation was? Larry James is absent. Alodia Arshel,
Yes po, Doc.
Sorry, Doc. Nagpuputol-putol po.
Mark Joseph, did you understand? Oh, si absent. Diyos ko, Lord. Okay, so anyway, my dear students, no, this is an illustration of the buccal capsule, no, of several of parasites. Look at Necatur americanus. Wala siyang teeth. Wala siyang teeth. Okay. This one would be Ancylosoma duodenale. 2 pairs of equal in size. Naintindihan? Okay, so they have, the inner tooth are actually inner in terms of size. The outer tooth are actually, again, equal in terms of size. Naintindihan? So 2 pairs of teeth equal in size. This is Braziliensis. Naintindihan? Okay. So anyway, if there is this one, no, the other tooth, no, these ones. Okay, Braziliensis. This is the illustration of your caninum. 3 pairs of teeth. No? This is the first. 1, 2, 3. No? So, tatlo. 1, 2, 3. Tatlo. Naintindihan? So, yan yung mga teeth nila. Okay, yan yung buccal capsule nila. Kaya importante, dapat makita natin yung buccal capsule ng parasite. Okay, so this one, I would like to ask Mr. Miss Anika Bielza, what is the sex of this parasite? Is it a male or a female?
Male po.
Why do you know that it's a male?
Dahil po dun sa end niya po.
Ha? How big is that? Of the
End
posterior
po.
portion. This is the posterior portion which we are locating already for the gubernaculum. Maintindihan? So the entire structure is the gubernaculum. The fan-shaped structure here is obviously your bursa. Okay? Can you see here, this one? This is your spicule that is barbed. Multiple spicule pero napato. Naintindihan? Oh, barbed. Okay? And it has actually bipartite dorsal rays. So this, my dear students, is Necatur americanus. Naintindihan? Okay na? Naintindihan? So Necatur americanus ito. Shallow cleft, bipartite, it have fused spicule, Necatur americanus. Okay. This is your copulating worm. When the ova, when the male and female parasite unites together, they will exhibit a Y-shaped, no, sexual style, sexual position, Y-shaped, no. Of course, this is the female parasite, and since that is a female, the copulating organ would be your gynecophoral canal or your genital primordium. So ito siya, naintindihan? Okay. And then this one is your male, okay, the posterior portion of the parasite united, no, with the gynecophoral canal. So it kaya tinatawag na Y-shaped position if they have sexual intercourse. Do you understand? Okay. Questions so far? Okay. No questions? Right.
None,
Okay.
Doc.
So, since that is the case, you would, I think, visualize that the gynecophoral canal has accommodated, correct, the posterior portion of the male parasite, and in which case the spicule have been able to unite with the vagina, the gynecophoral canal or the genital primordium to fertilize the female. So that is how it looks like. Okay. So another one here. This is the hookworm, filariform larva. Okay, so you would see this is the big form. You look into the tail of the hookworm larva. Remember, this is the larva. The tail of the hookworm larva remains to be pointed. Why? Because of strongyloides ova, which is knotted. Kapag strongyloides filariform larva, ito mga anak, putol ang kanyang tail. Parang putot. Naintindihan? Kumbaga aso, parang naputol yung tail. Ganon ang itsura ng Strongyloides stercoralis. Okay, let's look at the pathogenesis. When you pathogenesis, what are the diseases which are associated with the parasite. Okay, so of course, since the mode of transmission would be skin penetration, it would have to penetrate your skin, right? When larva penetrates the skin, it will have to bring about maculopapules or localized erythema. Makati kasi masyado yan. Dahil sobrang kate, kakamot ka. Naintindihan? And of which case, dahil kakamot ka, magkakaroon ka ng dermatitis. The other term for dermatitis would be ground itch. Why ground itch? Because the filariform parasite is there in the soil. No? It is also known as dew itch. Why dew itch? Because of the character of the soil, which is moist. Naintindihan? In other books, no, we have um, descriptions like coolie itch in Mexico. No? Coolie itch kasi cool yung soil. We have also box itch, no? In India. Lumabas ito sa board exam, yung box itch na yan. No? Yung mga taong mahilig mag-sunbathing. No? Normally, Indians would have to dig the soil and then they would have to bury themselves, no, for quite some time for them to feel relaxed. No? That's why the disease is known as box itch. And in other books, they would have Mazamora. Okay, they would have Mazamora. Okay, so all of these things, my dear friends, has something to do about your ground itch or dermatitis, of which you're going to scratch the area, no, because it's itchy, the area where the filariform larva tries to penetrate. Okay, now to elaborate that hookworms are in fact visceral larva migrans, I would like to reiterate that they also need to reach the lungs to cause pneumonitis as well as bronchitis. So from the small intestines, they will have to proceed to your lungs. So that's why they are called visceral larva migrans. No? And then hemorrhage at the site of attachment. My dear students, you have to remember they are hookworms. The moment they would have to attach to the intestinal epithelium, what happens is that there will be bleeding. There's bleeding not basically because they suck blood. There is bleeding because of the hooking, okay, of the adult parasites in the epithelium. And of course, because of blood loss, no, that is associated already to what we refer to as iron deficiency anemia. Now, in terms of appreciation of your iron deficiency anemia in your peripheral blood smear, no, this is described to be microcytic, hypochromic anemia. No? Okay, so which are described hypochromic, microcytic, no? The red blood cells are these. So red blood cells are microcytic and hypochromic for iron deficiency anemia. Microcytic meaning they are smaller than normal. Hypochromic meaning they would have lesser concentration of hemoglobin than normal. So if a normal red blood cell is red in color, a hypochromic red blood cell would be light red or pink in color. It means to say that hemoglobin concentration is actually low. Okay? Questions? No questions. Very good. No? So, how much blood loss is expected for the hookworm infection? For Necator americanus, you have 0.03 to 0.05 ml per day. But mind you, my dear students, it talks about per parasite. Per parasite. And then for Ancylostoma duodenale, they have 0.16 to 0.34 ml per day per parasite. So it's obvious that duodenale is more of a serious infection as compared to your Americanus. Okay? And then we have what we refer to as your creeping eruption. What is creeping eruption? Yan po yung creeping eruption. When you talk about the creeping eruption, I would like to highlight that in the 4 species of your hookworm, only 2 of them is called the real hookworm. And which are the 2 parasites? No? Necator americanus and Ancylostoma duodenale are the real hookworms. Pseudo hookworms, we refer to your Ancylostoma caninum and Ancylostoma Ancylostoma brasiliense. Why? Because of the CLM, cutaneous larva migration or the creeping eruption. No? Ano ba yung cutaneous larva migration or creeping eruption? Yes, these parasites would have to penetrate your skin. The mode of transmission would still be skin penetration. The infective stage of the parasite will still be your filariform larva, and they create tunnels, no, okay, in your skin. But remember, they do not grow as adults in man. They will never transform into the next developmental stage, which is the adult in man. What must be done is that they have to get out of man and infect their appropriate host to establish an infection. For caninum, they need to establish themselves in dogs to complete the life cycle. No? For Brazilians, they need to infect the appropriate host, which are cats, in order for the life cycle to actually continue. Naintindihan? So that is creeping eruption. Makati lang. No? They will not bring about anemia, sort of, no? Because basically they cannot naman proceed to the intestines. Naintindihan ba? Okay na tayo sa creeping eruption. So, which are the real hookworms? Only Ancylostoma duodenale and Necator americanus. No? Which are the pseudo hookworms, which are attributed to creeping eruption or cutaneous larva migration, Ancylostoma brasiliense and Ancylostoma caninum. Okay? And the last there would be your um, hypoalbuminuria, hypoalbuminuria, no, basically because the parasite feeds from the albumin. Okay. So, laboratory diagnosis will still be stool examination, obviously. Okay, not unless you're talking about visceral larva migration, where you're going to do lung biopsy. Okay, so the best thing that you do would be your concentration technique, and for your concentration technique, would have your ethyl acetate concentration technique or formalin ether concentration technique. Okay, so that's it. Dun sa, chine-check ko yung paper nyo, no? Actually, kung makikita nyo, nandun ako sa second part pa lang ng midterm exams nyo at prelim exams nyo. Midterms. Minsan na-frustrate talaga ako kasi yung iba, ang bababa ng scores, no? 2/10 sa bawat ano. Tapos tinitignan ko, ano yung mga hindi nila nakukuha, no? Ang simple-simple ng mga tanong, actually, pero hindi nakukuha. Katulad niyang sedimentation. Which one is a sedimentation technique? Of course, zinc sulfate is not a sedimentation technique because zinc sulfate is a flotation technique. No? The sedimentation technique includes your formalin ether concentration technique or your ethyl acetate concentration technique, where the parasites would have to settle at the bottom. Flotation technique, the parasites float. But whether they are flotation or sedimentation, they are concentration technique. If not, 90% of this class did not get that item, honestly. Kasi sabi ko, I'm afraid of the future, no? And I can't help but like tell myself, anong klase ng mga estudyanteng nakuha namin ngayon? Hindi ko alam kung produkto to ng open admission. Kasi parang yung caliber ng mga estudyante, humihina ng humihina. Kino-compare ko kayo doon sa paano nag-perform yung previous na batches. Parang may problema. Isang malaking problema. No? Tapos, ang next na problem dyan ay, paano kung magagawa ng paraan kung ang tatamad ng mga batang mag-aral? Paano kung magagawa ng paraan kung di, well, may problems tungkol sa connectivity, may problems tungkol sa mga blended learning, may ang daming problema. I'm nearly burned out really. Intindihan. Hindi ko na alam which one is the best way to teach you. Okay. Anyway, that is just my observation. Just to tell you, no, I am reading your answers, no, one by one, no. Now, for example, Miss Kak, si Kak medyo matataas yung nakukuha niya. And I wonder bakit siya parang 8, 7, 9, tapos yung iba 2, 3, 1, meron pang 0. Tapos mayroon kang nilalagay na mga answers na wala naman sa choices. Sabi ko, ano nangyayari sa mga batang ito? I don't know. I really do not know what's happening. But, well, now let's proceed to the third parasite. The third parasite is Strongyloides stercoralis. I told you that Strongyloides stercoralis is similar with the ova of your hookworm. They appear to be Morula Boll's ova. Correct? Now, the common name of Strongyloides stercoralis is threadworm. No? Threadworm because it's a very long adult parasite. However, a lot of nematodes are also threadworm. Example, Dracunculus medinensis, the longest nematode, is a threadworm. No? Trichinella spiralis is also described to be a threadworm. no? But please remember, we gave them other common names so as not to create confusion. So for Strongyloides stercoralis, the common name, let it be, no, that the common name is threadworm. Dracunculus medinensis, we gave it Medina worm as a common name, no? Trichinella spiralis, we give it trichinia worm or rubbish worm or garbage worm so as not to create confusion. But remember, in terms of description, they are very long parasites. They are all considered to be thread worms. Okay. Now, Strongyloides stercoralis is found in tropics and subtropics like that of the Philippines. The Philippines is found in a tropical country, the tropical area of the world, no? Similar as that of your Ascaris rhombicoides and of course, no, your Trichuris trichura and your hookworms, no? But remember the next two bullets I have. It's a facultative nematode. It is also a free-living nematode. When you say facultative, what does it mean again? It can survive outside, correct, the body of a host. Now, free-living, while it can survive outside the body of the host, it is able to continue its life cycle outside the body of the host. So Strongyloides is really a very unique parasite because it's a facultative and a free-living parasite. It exhibits parthenogenism. Parthenogenicity was already defined last time. It's the capacity of the female to fertilize its own ova. It's the capacity of the female to fertilize its own ova. None of the other nematodes are like that. Only Strongyloides stercoralis. Now, please remember that parthenogenism can only be appreciated in the indirect life cycle. Dean, bakit may indirect life cycle? Yes, you heard me right. Because there are 3 life cycle episodes for Strongyloides stercoralis. Direct life cycle, indirect life cycle, and the second one is auto-infection. I will be discussing that in a while. Okay, tatlo ang kanyang life cycle. So, the diseases associated with the parasite would be slight allergic reaction during larval penetration. So again, the mode of transmission that was disclosed to you right now would be skin penetration. So what is the infective stage? The infective stage would be filariform larva. So similar with the hookworm, no? Filariform larva, no, is the infective stage. Mode of transmission is skin penetration. Bronchopneumonia during larval migration to the lungs. So it just exhibits VLM, visceral larva migration, the transfer of the filariform larva to the other parts of the body. That adds to the invasiveness of the parasites and of Strongyloides stercoralis. And please remember about these diseases. Cochin China disease, Vietnamese diarrhea are attributed to Strongyloides stercoralis. Why? Because of severe malabsorption syndrome. How can we even explain for severe malabsorption syndrome? No, this one in an ultrasound procedure carried out to the patients, you would have honeycomb appearance of the intestinal mucosa. So if you do not understand what is honeycomb appearance, no? Okay, you get back to your histology. Your basic histology would have to tell you that the intestinal lining, the epithelium, as we normally would have to describe, no, and even would have to ask you draw, would be stratified columnar epithelium. And because it is stratified columnar epithelium, the villi would have different length. Correct? So, ganyan, may ganon, ganyan. Naintindihan? Yung brush border nila, magkakaiba ng length on a normal circumstance. But because of Strongyloides stercoralis, the lamina propria of the intestinal epithelium is being damaged. In other words, because it's denuded or damaged, it is eroded, so to speak. No? Nangyayari ay pare-pareho na lang sila ng length. Nawawala na kasi yung villi natin. So, imbes na kapag mag-drawing ka ay parang brush border na magkakaiba yung length niya, ito magkapareho na sila ng length. Naintindihan? So, tinawag siyang honeycomb appearance of the intestinal mucosa. Okay. Honeycomb appearance of the intestinal mucosa. Mr. Mark Joseph Maga, we have a question. None. Miss Miss Kak. Apa dito apelyido nga Kak. Nga deta nga Kak.
Wala akong question, sir.
Hangat to Kak.
Sanchez, sir. Sanchez, sir.
Ha? Sanchez Mira.
Opo, from Sanchez, sir.
Kulang
Ewan
to.
ko, sir.
Okay, sige. Banasan, you have a question?
Yes po, sir.
Yes, what's the question?
Sir, what about the treatment po ng natin? Strongyloides stercoralis po natin, sir.
All of the nematodes, no, except the the filaria worms, no, would demand, no, albendazole, mebendazole as gold standard. Naintindihan? Tandaan niya na pag protozoans, metronidazole ang standard cure. Pag nematodes, ang standard cure ay albendazole saka mebendazole. Naintindihan? Mebendazole is more promising than albendazole. But you can have other medicines like ivermectin. Yung tinatry nila ngayon, nakikita nyo, ivermectin sila ng ivermectin sa COVID-19, di ba? Bakit nagtatalo ang DOH? Kasi nga ang ivermectin, binibigay namin yan sa patients naming may parasite. Intindihan? Hindi sa taong may COVID, pero inaalam nila kung effective din siya sa COVID. So because it has anti-inflammatory effects. Yun naman ang sinasabi nila. Okay? Understand? Okay, so now let's proceed with the life cycle of the parasite. No? So for the life cycle of the parasite, we have 3, correct? Number 1, you would have your direct life cycle. No? You know, my students in the College of Medicine and in the doctoral degree or in the master's program in public health, when they hear me lecture about parasitology, they're just so in love with the subject. They'd always want me talk, and talk. Okay. So anyway, for direct life cycle, let's have ova, no? For example, Mr. Edsel has strongyloides, no? Tumae siya sa soil, okay? So the ova expelled in soil. Expelled meaning, no? Okay, it was actually brought in soil. Okay? So tumae, no? For example, si Edsel, ova expelled in soil. Okay? And then this ova turns to be your rabitiform larva in soil after the ova has hatched. Naintindihan? Di ba? The ova undergoes embryonation, 2 to 4 weeks. Tapos magka-hatch yan. Lalabas ngayon yung rabitiform larva in the soil. Correct? The rabitiform larva becomes a filariform larva. And take note, what is the infective stage? The filariform larva. So the filariform larva penetrates the skin of the host of the become an adult. Okay? That would have soon to lay ova. Is it clear? So this is the direct life cycle. Ayun uli natin, no? For example, Miss Aloja has strongyloides, tumae siya sa soil, and therefore yung ova napunta sa soil. No? Yung ova na yan, maging rabditiform, turning filariform, and then obviously it will have to penetrate the skin of a susceptible host. For example, let's take the case of Mark Joseph, and then what happens is that inside the body of Mark Joseph, it becomes an adult. Okay? So that would be direct. Madali lang, right? Naintindihan? Okay. Now let's have the second one, which is the indirect. No? I repeat, for the indirect life cycle, this is where you're going to appreciate your parthenogenism. So where is parthenogenism? So in other words, isang pinahabang kwento ng direct life cycle lang to. Now, what is that? Ova is expelled in the soil, it becomes rabitiform, it becomes filariform. However, the filariform chooses to become an adult, correct? Naintindihan? Adult. In soil, still in soil, right? Okay, and then the ova, okay, expelled by the adult. Naintindihan? Okay, the ova comes rabitiform, the rabitiform turns into filariform, the filariform, no, would be the infective stage, so it penetrates the skin of man to grow into an adult. Okay, so that is the indirect life cycle. My dear students, where is parthenogenism here? This one. The adults that lay ova in the soil exactly is what we are referring as your parthenogenism. Intindihan? Filariform larva in soil becomes adult. Adult will fertilize their own ova without the male. The ova, because it's fertilized, will hatch again in the soil. The rhabditiform larva will be liberated, becoming filariform, penetrating the skin of man, and eventually will be adults that will be formed in man. Okay, so that is indirect life cycle. Question so far? Easy, right? Okay, it's easy. What's that? What's this? Okay, I know it's okay. So question so far? No questions. And the third of the life cycle is what I refer to as auto-infection. Infection, my dear students, for the case of Strongyloides stercoralis, it talks about in movement and of larva to other parts of the body. Okay? More strikingly in the viscera. So exactly, my dear friends, this is the episode of the VLM, visceral larva migrant. Strongyloides is a visceral larva migrant. When the parasite would have to move to other parts of the body, then it is called the auto-infection. So please remember, my dear students, no? Auto-infection first is different from the auto-infection of Enterobius vermicularis. Why? Look, for Strongyloides infection, auto means self-infection. Naintindihan? Self-infection is that nandyan yung parasite sa loob mo at magpunta siya sa ibang parte ng katawan mo. Auto-infection for Strongy. But auto-infection for Enterobius vermicularis is different. What about Enterobius vermicularis? Ang sinasabi sa Enterobius vermicularis, the ova in your anus, in your perianal area, no, is actually derived using your nails kapag kinamot mo yung makating puwit mo sa enterobius. Naintindihan? Tapos kung aamuyin mo yan, ibig sabihin, no, yung ova were inhaled. Or kapag kakagatin mo yung nails mo, what happens? The ova were ingested. Naintindihan? So auto-infection for Enterobius vermicularis talks about you infecting yourself, but the entire phenomenon is outside the body. Naintindihan ba? Lumabas yan. In fact, walang mintis sa board exam, mga anak, lumalabas yan. Wala pang board exam na nagdaan na hindi tinanong ang difference ng auto-infection ng Enterobius vermicularis sa Strongyloides stercoralis. Naintindihan ba? So, pag Enterobius auto-infection, mula sa puwet dahil makate, kinamot, naintindihan? Tapos, it's either inamoy yung daliri kung nasaan yung ova ay nandun at saka kinagat, na-ingest. Enterobius. Strongyloides, hindi. The parasites inside the body infects other organs. Internal. Naintindihan ang pinag-uusapan. Okay, questions? Internal auto-infection. Wala? Kaya nyo na, may COVID pa rin kayo. Naintindihan? Okay, so my dear friends, I was talking about the life cycle, and then now we proceed to the pathology of the host. Ito, lumalabas din kalimitan sa board exam, hyperinfection syndrome. What is hyperinfection syndrome? The patients having Strongyloides stercoralis becomes immunocompromised. Immunocompromised would mean, no, you are inviting other parasites, other organisms, bacteria, fungi, viruses to attack your body. Naintindihan? Okay. It has something to do about obviously the status of a person. Naintindihan? So hyperinfection syndrome are seen in individuals who are immunocompromised, like those individuals who underwent organ transplantations, organs having immunodeficiency disorders, for example, HIV, people undergoing chemotherapy, they're immunocompromised. Okay? So intestinal symptoms would be, they would suffer from diarrhea, malabsorption, and electrolyte imbalance, and in which case, if there is electrolyte imbalance, it leads to severe dehydration and probably can become a cause of death. Fetal complications can be bacterial sepsis, meningitis, peritonitis, endocarditis. It is also affecting the lungs, I told you, right? So what do you expect of the lungs? No, there would be bronchospasms, diffuse infiltrates, as well as cavitation in the lungs. So in which case, my dear friends, no, strongy can become a very fatal issue. No, it can lead to death. Okay. No, you cannot afford not to memorize this table by heart. Maintindihan? The difference between hookworm and strongy. Because for all you know, sabi ko nga, magkapareho ang life cycle stage nila. And at some points, the ova are also similar. How does the ova look like? They appear to be having germ cells. Correct? Germ cells is known as cell segmentation. Ilan ang cell segments na nandyan sa ova niyan? Germ cells ang tawag dyan. So hookworms, I told you, would have 4 to 8 germ cells. Strongyloides would have 2 to 4 germ cells. Okay? Your rhabditiform larva and filariform larva, okay, are actually nearly similar, correct? Okay, but apparently there are differences. Naintindihan? Now, what are the differences? For example, the buccal capsule, the diameter of the buccal capsule for hookworms would be actually longer, whereas the diameter for the buccal capsule of your Strongyloides stercoralis would be shorter. Naintindihan? Mas mataba si hookworm kesa kay strongy. Kaya nga ang tawag natin kay strongy ay threadworm because it's a thinner worm although it's a longer worm. Naintindihan? Nakukuha nyo ba? So medyo mataba si hookworm, mapayat si strongy. Now, the second one is a genital primordium. Last meeting, I've made use of the word conspicuous, conspicuosity. If we are going to compare conspicuosity of genital primordium, alin sa mga nematode ang may pinakamalaking vagina? Genital primordium. Ang sagot natin, Enterobius vermicularis, followed by Strongyloides stercoralis, and the last would be hookworm. Kaya makikita nyo dyan, sabi niya, genital primordium for hookworm is inconspicuous. Halos hindi mo na makita. Strongyloides, it is conspicuous, but not as conspicuous as that of Enterobius. Okay? Naintindihan? Now, you would see there again, conspicuosity of the esophageal bulb. No? Sabi natin, sorry pala, no? Mali. Esophageal bulb pa lang sinabi ko kanina. No? Strongyloides stercoralis, pagdating sa genital primordium. Okay. Siya yung pinaka-malaki ang genital primordium. Naintindihan? Okay. Kasi ang genital primordium natin, no? S-H-E, no? Genital primordium, stercoralis, followed by hookworm, last would be Enterobius vermicularis. Pero pag ang pinag-uusapan ay esophageal bulb, ESH. Ang pinaka predominant ang esophageal bulb ay Enterobius vermicularis, followed by Strongyloides stercoralis, and the last would be your hookworm. Naintindihan? Okay na tayo? Pag genital primordium, S-H-E. Naintindihan? Pag esophageal bulb, E-S-H. Questions? Now, in the board exams, they would have to ask you, describe the esophagus of the adults of hookworms and strongy. What is the answer in the exam? Kasi ang board exam, mahilig sa ganito. Describe the buccal capsule and the esophagus of the hookworm. Okay. Number 1, no? Number 2, number 3, number 4. Letter A, 1 and 2 is correct. Letter B, 1, 2, and 3 is correct. Letter C, only 2 is correct. Letter D, none is correct. Mga ganun eh. Correct? Morse type sa mga anak. Kaya mahirap. Kaya nga dapat intindihin nyo. Sorry, ang course na to pang bright. Intindihan? Kaya dahil nandito kayo, panindigan nyo. No, wag lang tinatanong nila, anong course mo? Medtech. Naku, matakot kang magsabing medtech pag hindi ka nag-aaral. Kung ako sa'yo at hindi ka nag-aaral, mag-nursing ka na lang, mas madali. Malayong madali, sinasabi ko. Okay. Now, I was talking about the question in the board exam. It was like telling about how do you describe the esophagus of the hookworm and the strongyloides. Choices in the board exam would be shorter than broad. Yes, that is the description of the esophagus of your hookworm. Shorter than broad. Short ang kanyang esophagus. Naintindihan? Short ang kanyang esophagus with reference, naintindihan, to the diameter of the buccal capsule. To the diameter. Gaano kahaba yung buccal capsule. So ang sagot dyan sa board exam, shorter than broad. Naintindihan? Or shorter than long. Okay lang yan. No? Now, what about description of the esophagus of Strongyloides stercoralis? Ang sagot ay longer than broad. Mahaba ang kanyang esophagus, naintindihan? Okay, as compared to the length of the diameter of the buccal capsule. Naintindihan? So describe the esophagus of hookworm, shorter than long. Strongyloides, longer than broad. Questions? Naintindihan? Ito yung sinasabi ko kaninang tail, no? Sa hookworm, ang tail ng ating filariform larva ay pointed, whereas for Strongyloides stercoralis, ang tail natin ay notched. In other books, ang tawag sa kanya caudal tail. Sa ibang board exams, caudate tail. Pwede yan. Or sa isang board exam, nakita ko knotted tail. Pare-pareho lang yan. Intindihan. But again, the motion of the rhabditiform larva is purposeless. Okay? So this is in fact the esophagus of your Strongyloides esophagus niya, no? The length of the esophagus is long as compared to the diameter of the buccal. Kaya nga sabi natin, the esophagus is longer than broad. Okay na? Naintindihan? Hi, are you with me? Ayan, no? Longer than broad. Now, if you ask, Dr. Capillo, what is this? This is the esophageal bulb. No? Okay, let's proceed. This one, Mr. Ano ba ito? Mr. Guba, no? Tell me the sex of the parasite. Male or female? No, Christine is not there. Similar as with other students, perhaps they just have, hooked in and then they left. No? Wow. Yan. MCNP, papasok, kunwari, magko-close ng camera, kunwari kikinig, wala naman. No? Let's try, valido. What is the sex of this parasite? No. Ganyan. O di wala lahat. Peralta, what is the sex of this parasite?
Female, sir. Doc.
What is
Female,
that?
Doc.
It is
Female,
a?
Doc.
Why did you say
Female.
it's a female? It is a male.
Male, Doc, kasi
Why
curve.
male? Correct. Because it has a curved tail. Oh, naintindihan? Okay, that's a male because it has a curved tail. Okay. So this is in fact the filariform larva, or it can be an adult parasite. No, the black arrow points into the gynecophoral canal. This is the vagina of Strongyloides stercoralis, and the white there talks about the ova of the parasite. Why? This came in previously for the last two batches of the board exam. Ito yung tanong, kaya kinuha ko na rin lang na illustration. Ang tanong is, if you see a larva stage in stool, can the diagnosis be Ascaris, Trichuris, or hookworm? If not, what can be the diagnosis? No? Inuulit ko yung question sa board exam. No? Ang tanong sa board exam, if you saw a larva stage in stool, no? Can your diagnosis be Ascaris, hookworm, or Trichuris? If not, what can be the diagnosis? Yun yung tanong. No? So, ang sagot doon mga anak ay, hindi pwedeng Ascaris, Trichuris, or hookworm, no? Ang choice kung makakakita ka ng larva doon sa stool. Why? You should not see larva in stool for Ascaris, Trichuris, and hookworm because they require the soil for embryonation. The moment they are expelled in the stool, walang larva dyan. Puro yan ova. Kailangan niya mapunta sa soil para mag-embryonate. Yun yung sinasabi niya. Okay, not unless if there is improper sample collection. Not unless if there is improper sample collection. And of which case, kapag hindi pwede ang Ascaris, trichuris, and hookworm, no, na diagnosis mo, pag may nakita kang larva sa stool, ano yung diagnosis natin? Ang pwede lang ay Strongyloides stercoralis or Enterobius vermicularis. How? If you're going to see a ova in a stool, naintindihan, ova of a hookworm in a stool, then it would be diagnosed as Strongyloides stercoralis. If you don't see an ova in the stool, then your diagnosis would be Enterobius vermicularis. Naintindihan? So pag may nakita kang larva, wag mo nang pestehin ang sarili mo sa larva. Naintindihan? Hayaan mo na yung larva, no? Maghanap ka ng ova. Okay? Kasi hindi mo mahabol-habol yung larva na yan. Kapag nakita mo yung larva, hayaan mo na si larva, ang hanapin mo ay ova. Kung may nakita kang ova, naintindihan, sa stool na may larva, ang diagnosis mo, strongy. Pero kapag may nakita kang larva, pero wala kang nahanap na ova, then ang diagnosis mo ay Enterobius. Why? Because you never can see ova of Enterobius vermicularis in stool. Okay? So mga anak, ganyan sa board. Naintindihan? Ganyan sa board exam. I challenge you to study. No? There's no way out. Panindigan mo itong kursong gusto mo. Kung gusto mo, hindi dahil gusto mo lang. Naintindihan? Kasi naaawa ako sa mga estudyante ko na pangatlong take na ng board exam, hindi pa rin pumapasa. Kasi nga, kulang ang pundasyon. No? Tapos tanungin yung mga ate at kuya niyo, sasabihin nila, kung alam ko lang, nag-aral ako ng second year, third year, fourth year ako din. Ngayon lang ako sa review naman kasi nag-aaral. How can you compress everything in less than 2 months? Lahat ng subjects, aralin natin in less than 2 months. What miracles do we need? Naintindihan? And I don't even, believe that there will be miracles if that's the case. Okay, so this is the morula balls ova. Okay? And then the treatment for strongyloides would be albendazole, mebendazole, but what we normally give in particular if there are already auto-infection, visceral larva migration, would be ivermectin and thiabendazole. Direct and indirect infections are controlled by improved hygiene, and auto-infection is controlled by chemotherapy. Okay, so that's the end. I won't dwell further because my mom is asking me to make an errand for her. Okay, so I hope there are no questions. So by next week, mga anak, meet